Today in this lecture, we will discuss the importance of aldosterone. Aldosterone is an important hormone and it has an important role in urine formation and regulation of body fluids as well as electrolytes like sodium and potassium. There are a lot of hormones in the body which regulates the urine formation and maintenance of body fluids and electrolytes. So some of the important hormones are aldosterone, angiotensin 2, antidiuretic hormone, atrial natriuretic peptide, and parathyroid hormone. Now, today we will focus on the role of aldosterone. Aldosterone is basically secreted by the zona glomerulosa cells of the adrenal cortex. Adrenal cortex is basically a gland which is present above the kidneys, and there are different kinds of cells. From the zona glomerulosa cells of the adrenal cortex, aldosterone is secreted. Aldosterone, once secreted, it acts on the principal cells of the cortical collecting tubule. So here we have the cortical collecting tubule. We have discussed so many times that in the nephron, we have the Bowman's capsule, the proximal tubules, the loop of Henle, the distal tubules, and then the collecting tubules, and finally the cortical collecting tubules, and then the medullary collecting ducts, etc., etc. The aldosterone acts at the level of cortical collecting tubule here, and they specifically act on the principal cells present in the cortical collecting tubule. Now, aldosterone role is to increase the reabsorption of sodium and increase the secretion of potassium from the body. So its purpose is to increase the amount of sodium in the body and to decrease the amount of potassium in the body. And how it acts, it basically increases the action of sodium potassium pump. So sodium potassium pump reabsorbs sodium and it secretes potassium. So this pump, the activity of this pump in the principal cells of the cortical collecting tubule is enhanced by the aldosterone, and it in turn lead to increased sodium reabsorption and decreased potassium reabsorption or increased excretion of potassium. Now, normally aldosterone will increase the body sodium level and decrease the potassium level. Now, there are some conditions in which there is either decrease in the production of aldosterone or there is increase in the production of aldosterone. Now, the most common condition in which there is loss of aldosterone production is Addison's disease. In Addison's disease, there is loss of action of aldosterone on these cortical collecting tubule because there is decreased formation there, because the adrenal cortex, the cells that are producing the aldosterone are destroyed. So in Addison's disease, there is loss of aldosterone. Hence, there is increased accumulation of potassium. There is increase in accumulation of potassium. The potassium level in the body increases, and there is decrease in sodium. Sodium is lost. Now, there is another condition known as Conn syndrome. In Conn syndrome, the production of aldosterone is increased. So there is increased action of aldosterone on the sodium potassium pump of the principal cells of cortical collecting tubule. Now, this time, due to increased action, there is increased excretion of potassium. There is increased loss of potassium, and there is increased loss of potassium and increased reabsorption of sodium. So this time there is a high level of sodium and very low level of potassium. Now, these are two different conditions, the Addison's disease and the Conn syndrome, in which due to the decrease and increase of aldosterone, the body fluid levels and the electrolytes gets disturbed, and both of these conditions leads to increase and decrease formation of urine, or there is increase and increase or decrease, or there is alteration of the body fluid volumes as well. Specifically in the Addison's disease, there is loss of volume. The patient is most of the time hypotensive, and the patients even get postural hypotension. Whenever the patient stands from a sitting position, the patient gets dizziness. So these conditions prove the importance of aldosterone in the formation of urine and maintenance of body fluids and maintenance of electrolytes, specifically sodium and potassium. So that's all about the action of aldosterone and its importance in the regulation of body fluids and electrolytes. Thank you for watching the video.